support allows Glaucoma Research Foundation to forward innovative research about glaucoma, leading us closer to a cure. Now it is my very sincere pleasure to introduce a good friend, one of our scientific advisors, and our featured speaker today, Dr. Ann Coleman. Dr. Coleman is a professor of ophthalmology and director of the Stein Eye Institute Centers for Community Outreach and Policy. She received her medical degree from the Medical College of Virginia and completed her fellowship in glaucoma at the Wilmer Eye Institute at Johns Hopkins University. Dr. Coleman also holds a doctorate in epidemiology from the UCLA School of Public Health. Dr. Coleman has wide-ranging interests with research focused on the diagnosis, treatment, genetic environment interactions, and the societal impact of glaucoma, cataracts, and macular degeneration, including lifestyle limitations imposed on patients with these diseases. Dr. Coleman continues to serve as an investigator for a number of ongoing studies and clinical trials. She is actively involved in national outreach programs in ophthalmology. Well, with that, I'd like to welcome Ann, and thank you so much for being with us today, and we look forward to your presentation.
Well, Tom, thank you for inviting me to talk today. And as you mentioned, I'm going to be talking about lifestyle choices and glaucoma because there's people have a lot of questions about living with glaucoma, or are there really things that we can do to minimize the risk of us losing vision beyond drugs that lower the eye pressure or surgery that lowers the eye pressure. And that's the focus of today's talk. Just to kind of let everybody know, so that we're kind of all up to speed, is that glaucoma is the loss of vision. And this vision loss occurs in some part due to the eye pressure or the intraocular pressure. And so like any enclosed sphere, there's a pressure inside that sphere because there's fluid that's made in the eye, and then although it exits the eye, it still has a pressure inside it. And so the amount of pressure in that eye can be too much for the optic nerve that takes the images from the retina, the film-like structure of the eye, back to the brain. And so we describe it as raised eye pressure or raised intraocular pressure, but it might be eye pressure that's normal for the population. But this pressure, whatever it is, in glaucoma is too high for the nerve and the cells in the eye, and so it damages them and can cause them to die. And one of the things we've found in our studies so far is that lowering the eye pressure is the best way to slow down or prevent vision loss if you have glaucoma, if you're someone who is susceptible in terms of the nerve and the nerve cells to this pressure in the eye. There's also been research looking at what type of things that we do in our ordinary life choices that can affect eye pressure, and also what can we do to maybe lower eye pressure. Because although eye pressure is not glaucoma, it can be associated with glaucoma, or a pressure that's too high for the eye can cause glaucoma, which leads to vision loss.
You know, Ann, one of the interesting things is that Glaucoma Research Foundation actually funded the very first clinical trial, a collaborative multi-center study some 20 years ago, more than 20 years ago, to establish that lowering eye pressure does preserve vision. And then, as you well know, after that study, many other studies were funded by the government in both the U.S. and in Europe to look at different types of glaucoma and different types of patients and come up with the best possible treatments for different patients.
Yeah, this study that was funded by the Glaucoma Research Foundation has actually been very important for clinicians, because prior to this study, it was debatable whether we had to lower the pressure in someone who had what we consider normal pressure, or pressure that's average for the population of people in the United States, for example. And so in this study, we found that even if you have normal eye pressure, pressure that's in the normal range, if you have what we call glaucoma as low-tension glaucoma, it's worth it to lower the eye pressure. So that was a really important study, Tom. So thank you to the Glaucoma Research Foundation for funding that and making it possible for us to get that new knowledge. Because one of the things I think you'll see and realize as I go through today's discussion is that we know some things, but we really need to know a lot more. And the only way we learn more is through research. We really have to look for the evidence so that we can really treat our patients. And then they can also participate in their care with the best knowledge and the best evidence. So one of the questions that comes up a lot is exercise. Do I need to exercise? And if you have glaucoma, or even if you don't have glaucoma, I would say yes. For those patients with glaucoma, aerobic exercise such as running, swimming, cycling, dancing, any of these activities that are good for your heart are going to be good for your eyes, because they're going to lower your eye pressure. Now, one of the things is that you can't be exercising all the time, and so the pressure can come back up a little bit. But if you're doing routine exercise, that's really going to help with your cardiac health, and it's also going to help keep your eye pressures in a better range for yourself. It might not get them to where your doctor wants them, but at least it's going to help with the control. And so that's really important to realize how important exercise, especially aerobic exercise, is to lowering the eye pressure, but also to your general health in terms of your cardiovascular system. Now, one of the things that I have on my slide is that not all exercises are ideal for glaucoma patients. And if you can see, there's a little picture of someone kind of really stressing, really grunting to lift a really heavy weight. And that's what we call a Valsalva maneuver, where you really push and you hold your breath and then you grunt and push that weight up. That's not good. But for glaucoma patients that are especially under so-so control or tenuous control, because that Valsalva maneuver, which can happen at many times, like even if you're constipated, when you really grunt, that can raise the eye pressure. And you don't want to have so many episodes of that. So for these weight trainers, we recommend that you breathe out, that you're not holding your breath when you're lifting heavy weights. And for some patients that have, they're under what I would call tenuous control, I'm concerned about them, I ask them not to lift weights over their head. I ask them to really try to cut back on that, because we need to do more research on it. But we do know that when you really lift heavy weights over your head, you can raise your eye pressure. The other thing is like if you do upside down positions in yoga by doing a headstand. If you're someone with glaucoma and you and your doctor are struggling to get it under control, or you're losing vision, or you're at risk for that, standing on your head can increase the eye pressure. There have been studies where people who used to wear those gravity boots and hung upside down, their eye pressure went up markedly. And so we don't recommend it for patients with glaucoma, because once again, those spikes in eye pressure can be not good for eyes that are susceptible to the damage developing with high eye pressures. And so we don't recommend headstands, for example, or gravity boots hanging upside down. Now, one of the questions I get a lot from my patients is, well, what about downward dog when I'm doing yoga? Well, downward dog can be associated with increasing the eye pressure in studies. And so if you're someone who your glaucoma, once again, isn't well controlled, or you're concerned about it getting worse, or you're having damage, then you shouldn't do the classic downward dog. You would want to talk to your yoga teacher about modifying it, because they do have positions you can do where you would do it on a chair, for example. And so therefore you wouldn't get the increased pressure in the eye from the head hanging down.
And what about, say, straining a bowel movement, or someone who maybe is constipated? Can that elevate eye pressure? What do you recommend there?
Yes, that can elevate eye pressure. And, and sometimes in life, people can't help it. But the issue is especially, let's say, after glaucoma surgery, I really encourage my patients to use agents that help prevent constipation, because I don't want them straining and raising the eye pressure and then potentially causing problems with the surgery. For the average person who's not had glaucoma surgery, little incisional surgery, I recommend for them to try to have a diet that provides leafy green vegetables and fiber, so it really minimizes the constipation.
So it looks like you're hitting all my favorite topics: exercise and good diet, and of course not smoking. Right? You haven't touched that one yet, but
no.
I think those are so important, just for general health and certainly for glaucoma as well.
Right, and so and that's the next slide about what do you eat, and we have.
I don't see steak on there. What happened?
Yeah, the main thing in the studies is showing that you really want to eat your leafy green vegetables. So kale, collard greens, these are the items that you really want to eat. So you want to make sure you're eating enough leafy green vegetables. Spinach, important also. It's thought that the nitrates in these leafy green vegetables can help with the eye pressure and also with glaucoma. We do have some studies showing that carrots may be important with glaucoma, and peaches and foods high in vitamin B2. But the most important thing is to really follow the U.S. recommendations for the food chart and to cut back on fatty meats such as steak, to cut back on fats that you see in processed foods, also sugar, too much sugar you're not supposed to eat. In addition, too much salt, because if you think about what you're supposed to eat for having good heart health or cardiovascular health, that's also a good diet for your eyes and for glaucoma. And so I think that it's really important in life that when you're getting these healthy habits to realize that you're exercising, but you also want to be eating right, not just for your heart, but it's also going to have spillover into your eyes. And so this makes important difference not only for glaucoma, but also for macular degeneration. The studies show how important spinach is, for example, for helping to protect people with macular degeneration. Next is, well, what do you drink? Once again, it's really recommended you drink water. One of the issues, though, is it's not recommended that you do what we call water loading. So if you're running and then you sit down and drink a gallon of water all at once, that water has to go somewhere, and once it gets into your body, it can increase the eye pressure for an hour or two, and then it slowly comes down. So you want to be really aware of not drinking too quickly, too high a volume of fluids, because that can increase the eye pressure. And if you're someone who your doctor's worried about your glaucoma getting worse, or you think that you're having changes in your vision from your glaucoma, you really want to watch drinking too many fluids at once. In terms of what else do you drink besides water, well, you can drink other beverages. It's like everything, you want to do it in moderation. And so caffeine, there's still a lot of research that needs to be done, whether coffee is good or bad. And so you want to be aware of that. And same with red wine. You know, there are studies that are showing that red wine can be potentially beneficial because of the antioxidants for your heart health and possibly for your eyes. But you want to do it, once again, in moderation because red wine can be very bad for your liver. So it's like everything. You don't want to do too much of one thing. A life in moderation is better for a life with glaucoma. Next is Tom's, one of his favorite topics is smoking. And it's really important not to smoke. The cigarette smoking is known to cause problems with the vasculature. It's not known its direct effects on glaucoma. We're currently doing research on that. But in terms of its effects on your cardiovascular health and on your lung health and on your cancer risk, it's horrible. And so smoking is really the worst poison you could be putting in your body today. And so it's really encouraged to work really hard to stop smoking. If you have macular degeneration, smoking can make it a lot worse, so you go blind a lot sooner. And so smoking is quite toxic to the body. In terms of marijuana, we really haven't had an opportunity to do a lot of research on marijuana because you know it's really illegal federally. And so a lot of funding comes federally, and a lot of the states haven't really allowed it until recently. And so there's a lot we don't know about marijuana, smoking, or even eating marijuana in chocolate, which is how some people have it. There were studies done back in the 60s showing that when you smoked marijuana, it did lower the eye pressure, but it was felt that you had to be in an altered mental state all the time for it to be effective. And so it's really not recommended for glaucoma, although if you go to some of the dispensaries in California, they're saying that it is a treatment for glaucoma. It's not a treatment for glaucoma. We need more research on this. Marijuana smoking has many other negative effects that are starting to come out, and unfortunately it really hasn't been studied. And so although it tends to be popular among certain patient groups, you need to be aware that you might end up having done yourself a lot of harm, that it might be just as bad as cigarette smoking. In terms of other choices we make, one of the choices is sleeping. It's really important to sleep. I think that there's been a trend for people to get less sleep, and so recently as physicians we've really been trying to encourage people to get 7 to 9 hours of sleep a night. That really helps with your health, and it's good for your cardiovascular health, which is good for your glaucoma or your risk for glaucoma. And sleep is also important because of how you sleep. If you sleep with your head up on like 2 pillows, which gives you about a 20 to 30 degrees heads up position, your pressure is going to be about 10 to 20% lower. So that can be lowering the pressure, a couple of millimeters of mercury, which might be important. It's also important with sleep position. If you have glaucoma in one eye that's worse than the other eye, I'm starting to encourage my patients to think about how they're sleeping. Is the glaucoma worse on your left eye because you sleep on your left side? Because that eye that's down closest to the pillow does have a higher pressure. So it's something to think about if the doctor is having trouble controlling your glaucoma, or you have glaucoma that's different in both eyes. You might want to see if you can sleep on your back with your head up. In terms of sleep disorders, there's a lot of research showing that there probably is an association with sleep apnea. And the way sleep apnea works is, when you have sleep apnea, you really stop breathing for a couple of minutes during the night. And when you stop breathing, you stop bringing in oxygen, and the eye and the optic nerve need oxygen. And so this lack of oxygen can cause nerve cells to die. And so it's really important to get evaluated if you're snoring a lot, or if you're finding yourself waking up and you felt like you didn't sleep at all, or you're really fatigued, or you have other issues with your sleep. You really want to talk to your primary care doctor about this to look and see whether you should be evaluated for sleep apnea. There's been some work showing that maybe the positive airway pressure machines may be increasing pressure, but it might not be increasing pressure causing as much damage as not having oxygen to the eyes or to the brain. So you really need to get evaluated if you have sleep apnea. And then they could even check the pressure while you're using the CPAP machine if you have it. One of the things that's older research, but it's still relevant, is that we found that if you wear a tight necktie, like a tight bow tie or a necktie, which used to be in fashion in the 80s, your pressure went up in the eye. And so it's kind of constricting your neck, and that causes everything to back up into the head and the brain and the eye, and that would raise the eye pressure. One of the things to be aware of is if you wear swimming goggles, you want the goggles to not push on the eyeball. A lot of people get the little teeny goggles, and so when they're swimming, it can push on their eyeball, and it really should be pushing on the bone surrounding the eyeball. So that's really important. You want to have a larger swimming goggle so that it's pushing on the bone and not pushing on the eyeball if you're at risk for glaucoma or if you have glaucoma.
Well, those are good inputs, and especially I like the one about wearing neckties, because I've been studiously avoiding wearing neckties to the office, and now I have a good reason. So.
Oh, good. Yeah, you can. The other is for musicians. Now, not all musicians get glaucoma, but if you're someone who's susceptible to it or has a family history, you want to be careful if you play like the oboe, because that's going to be like a Valsalva or like a constipation. When you blow really hard, or it can increase the eye pressure. And we've actually done studies showing that when you're playing a trumpet or the oboe, the pressure shoots right up there. So if your nerve is susceptible, you might want to rethink that hobby if you're getting worse. You want to think about it. It's like a lot of things in life. You kind of have to balance it with, is this your livelihood? Do you play the oboe for your livelihood so you have to play it? Or is it a hobby? Or is your glaucoma just not that bad? Or you don't even have it, so it's okay to play it? You need to discuss these things with your doctor. That's the most important thing to do. So in conclusion, we really recommend your maintaining a healthy lifestyle. That's the best thing you can do for your life, but your cardiac health, for healthy aging, also for how well you think when you're older, it's really important to maintain a healthy lifestyle, and also for seeing in terms of glaucoma. It's extremely important to have that healthy lifestyle. And then remember that you want to get some aerobic exercise. It's recommended that you get it 4 to 5 times a week. Every day is even better if you can get that in to your lifestyle choices during the day. You want to stop cigarette smoking. You want to eat leafy green vegetables like spinach, kale, collard greens. You want to avoid water loading, where you drink a lot of water at once, or chugging water, as they used to call it. You want to avoid head-down positions, such as you see with headstands or those gravity boots. And then if you wear a necktie, you want to make sure it's not too tight, or don't wear one like Tom. And then you really want to be evaluated if you have symptoms that suggest sleep apnea. And so you really want to be talking not only to your eye doctor, but also to your primary care doctor, because we're connected all over. We're not just eyes, and we're not just a cardiovascular system. We're people, and it's all connected. And so what you do in one part of your body and your life can really impact your eyes, and also vice versa.
Well, Ann, that's really great advice, and I particularly like that last slide of maintaining a healthy lifestyle and really talking with your doctor, because as you know, and as some of our caller or participants probably know, glaucoma is a lifetime disease, and that relationship with your doctor is so important, and really sharing information not just about your glaucoma, but your general health and other health issues and medications and so on is really important. And then listening to the doctor and questioning and having the kind of relationship where together you can work to preserve your vision for your lifetime is so important. So we do have quite a few questions, and an interesting one is, what about black currants? Do you know anything about the eating these kinds of fruits, I guess, that to prevent damage to the optic nerve?
No, I don't. About for black currants, there's, and I don't know of any specific research on that. A lot of our dietary information about what to eat or not to eat is coming from a questionnaire called the Food Frequency Questionnaire. And so in there, they'll ask, you know, what types of fruits you're eating and everything, but it's kind of a checkbox. And I hadn't seen anything about currants where people had answered about that.
Now, another one that comes up a lot is ginkgo, and I know that even a famous glaucoma specialist in New York was advocating ginkgo. What's the story on that in terms of hard data, or even just the importance of that type of a, I guess, natural food or natural product?
Yeah, so for ginkgo, we were all hoping it would help with everything, including Alzheimer's prevention.
Okay. All right.
Yeah, but I think that unfortunately so far the evidence is not showing much positive results or outcomes from ginkgo at this point. One of the issues that people have is that, you know, we have a tendency, we want to take supplements, and the United States has a huge supplement industry because we do want to take things that can help or give us an advantage. And then, you know, there's quite a bit of advertising about it. But unfortunately, many of these agents, the evidence is still lacking. And
yeah, I think
that's the problem.
To your point, and we actually, on our website, if people want more information, they can go to our website, which is glaucoma.org. So it's very easy to remember, just glaucoma.org. And there's a search box there, and you can just type in supplements or ginkgo or the questions about that you might have about different food items. And as you point out, there really is no hard research on almost any of these to show that they actually have any impact on glaucoma. I mean, with some exceptions, as you point out, some of the green leafy vegetables, you know, generally speaking, but eating healthy is probably more important than supplements, and it's they probably don't do any harm, but the one thing they do is cost money, and maybe they're better uses for those funds than unproven supplements or so again, I would say consult our website. You can also consult the NIH.gov, National Institutes of Health.gov, and look there for information. But it is, it definitely is my impression, at least, that having a healthy diet and exercise are the most important, and it's really questionable whether supplements, at least as relates to glaucoma, have much impact. And there certainly are no studies that we are aware of, and I think that you're aware of, that would support any particular supplement.
Right.
So we have another question, interesting one. What about teeth grinding? Other than being bad for your teeth, does that contribute to higher eye pressure?
So, not known to contribute the teeth grinding. I think it's a interesting question. I guess that would be a good study to see if someone who's grinding their teeth is going to increase the eye pressure. It's probably less likely to do it because when you're grinding, you're probably still breathing. And so you're not doing the Valsalva maneuver that's known to increase the eye pressure. The issue about the teeth grinding also, though, is it causes spasm of the muscles in the jaw. But once again, those aren't really directly connected to the eyeball. And so probably there is no effect. But it's like all things, we always think of good research ideas from questions from individuals and patients. And so it could be something that would require further investigation, although in thinking about the mechanism of it, it would be considered to be less likely an effect on eye pressure.
So another interesting question, Botox, which is I guess relaxes, is used for treating wrinkles because it can relax the muscles to get rid of some of the wrinkles that some of us don't like. And so the question is, could you use Botox to reduce intraocular pressure? What do you think about that one?
Well, once again, that's kind of like the teeth grinding. The Botox is used to relax muscles around the eyeball, but that aren't attached to the eyeball. And so it's probably unlikely that it's going to lower eye pressure. But this kind of refers to stress. And, a lot of patients feel that stress increases their eye pressure. And the way stress is going to work is through your cardiovascular health. And so, and that's where for Botox around the eye area is probably unlikely to affect the eye pressure. But meditating and mindfulness may help because that might help with your cardiovascular health, which would then help with your eye pressure and your eye health.
That sounds like sound advice. Another question is, what about eye drops causing lightheadedness? Is that something that you're familiar with, or this is?
Yes, I think that I think that one thing that we forget as individuals is that what you do to your eyes can affect your body, and that's one of the things I was trying to emphasize, that your body affects your eyes, but your eyes also can affect your body. And so when you put eye drops in your eyes, those eye drops can get absorbed into the rest of the body. And there are eye drops that can cause lightheadedness. So it's really important that when you put your eye drops in, you immediately close your eyes, immediately. And you keep them closed for at least a minute or two. And while you're doing that, you take your finger and place it next to your nose to really block the eye drop from going into your nose or into your mouth where you can taste it. and that can cut back on your body absorbing the eye drop. But there are glaucoma eye drops that could cause lightheadedness. And so it's important for that individual to, one, talk to their ophthalmologist about it, but also to talk to their primary care doctor about it. Because lightheadedness can lead to fainting, and fainting can lead to falls, which can lead to injuries. So you really want to have it looked into what's causing this, because you don't want to faint and fall, because it also might not be the eye drop. It might be something else that's going on in the person's body that the primary care doctor might detect.
So again, some great input, and again, harken back to your earlier comments that you don't just treat the glaucoma or you treat the eyeball, but you treat the person. And so all the things that are going on in a person's health could be relevant. And again, the importance of really talking with your doctor, talking with your internist. And even if the question may seem a little silly, or you may think, well, it can't possibly be related, as you point out, it's important to get those questions answered. Another one about herbal teas helping to maintain pressure. Any thoughts about the use of, I guess, different types of herbal teas, turmeric or ginger or others, that might impact eye pressure?
Not that we know at this point. Once again, the herbal teas are similar to the conversation about the supplements. There's just a lot more research we need to do. And I think that there's a whole alternative medicine world that's currently being investigated, where we're looking for evidence in terms of how these agents work, if they do work. And I believe that both turmeric and ginger and the chai tea need to be further investigated. Most important with teas and fluids and caffeine and everything is to realize is to not overdo it, to not do any water loading.
Okay, well, we still have time for more questions. If people have questions that they'd like to ask Dr. Coleman, someone did comment again about the importance of teaching how to take eye drops, and I will also mention that, again, on our website, glaucoma.org, if you put into the search box how to take eye drops, we have several articles about and graphics showing how to take eye drops. And as you point out, it is important to keep the eye drop in your eye and not have it drain down into your nose or mouth, where it starts to be absorbed systemically and can have other side effects. I don't know if you want to add anything on that.
No, the issue is there's also a question from the same individual about how long to wait between eye drops, because one of the ways we treat glaucoma is a lot of times it's like we give you an eye drop, and then you come back and your pressure's still not where the eye doctor wants it, so they give you an additional eye drop to take with the first eye drop. And for my patients, I tell them to wait 2 minutes. So to listen to a song, put on some music. Most songs are about 2 minutes, so keep your eyes closed for 2 minutes with your finger there, and then put the second eye drop in. Some of the ophthalmologists recommend 5 minutes, but you want it between 2 and 5 minutes. For me, in the studies that I looked at, it's about 2 minutes is the right amount of time, but 5 minutes is fine also. But you do want to not put the drops in like within immediate succession of each other. So you want to wait.
Another interesting question about alternative treatments that have been shown to be effective for glaucoma. And there's a whole host. The Internet's a wonderful thing because there is so much information there. That's the good side. The bad side is that there's no quality control. There's no FDA that is monitoring the Internet. So there is both good information and some very bad information. And one of the things, if you look at glaucoma therapies, you can find videos, and I've done a little of that just to see what's out there, and it's actually kind of scary when you see some of the things that are proposed, and there's no clinical data, nothing to support them. Are you aware of any of these so-called alternative treatments that where there's actually, like a drug study where you have a blinded, controlled, prospective, randomized trial to show that it actually works? Is there anything like that for glaucoma that you're aware of?
Not that I'm aware of at this time. But I think that there is interest. I think the National Institute of Health Center for Alternative Medicine is looking into different trials, very similar to the drug trials, but they're quite expensive, and so
yeah,
not that I'm aware of.
To do a good trial is very expensive. I know that, and again, it's interesting with macular degeneration, there was the Johns Hopkins, the study that Susan Bressler did with a combination of, I believe, vitamins and minerals that through that type of really careful, controlled clinical trial was shown to benefit a certain group of patients. I think those that had very early mild disease or maybe early in the disease anyway. I think there was some very mild benefit from that specific group of vitamins, and I think that is marketed now. Is that, maybe you know more about that, Ann, than I do?
Oh, for the particular
the ARID study.
Right. Yes, they do market them, and so you want to talk to your eye doctor about which ones they recommend for you to take, and they'll be able to help direct you because you want to make sure you have the correct formulations when you take these medications, because some combinations are not as effective as others. And it's also important if you're a smoker that you get the right formulation, because although people think of supplements as safe, it was found that the beta-carotene was associated in smokers with increased risk of lung cancer. So you want to be careful and make sure you're getting the right formulations for the lifestyle choices that you've made.
And the ARID study was specifically macular degeneration. There's no parallel study, again, of which I'm aware of any combination of vitamins, minerals, or anything else that helps glaucoma.
That's correct.
Now, there's another interesting question here, and since many of our participants are looking at their computer right now, what about working all day on a computer? Does that have any impact on glaucoma or on eye health generally? What's your thought about that?
Well, one of the issues is that as far as we know, looking at a computer is not bad for you in terms of glaucoma, but it is important to blink and to kind of not stare where you're not blinking. And so what happens is people are kind of staring at the computer, or maybe they're doing a computer game, and so they're forgetting to blink. And so that's a problem, because when they don't blink, they're not, the tears on the eye, the surface of the eye, aren't spread out over the eyeball. And so then the eyeball dries, and then that can make it more irritated for glaucoma drops, or even just for seeing. So staring at a computer is not going to affect the eye pressure, but it is going to affect the wetness of the eye, and it's going to dry it out. And so you really want to be blinking.
So another interesting question, what about other sort of over-the-counter medications that people with glaucoma should avoid? Are there are there some medications that we kind of routinely take, like, I'm going to say aspirin just to show you how old I am, but that would not be good to take if you have glaucoma?
So that's an interesting question. One of the things that can be maybe not helpful if you have glaucoma is oral steroids or nasal steroids. It's not that you can't take them, but you need to make sure that the eye doctor is aware that you're taking them because they can raise the eye pressure. In addition, if you don't have glaucoma, but your primary care doctor or a doctor puts you on oral steroids, you want to make sure you go and see an eye doctor several weeks later of taking them, just to make sure you're not one of those individuals whose eye pressures get higher with oral steroids or nasal steroids. So it's important to be aware of that. And so that would be one of them. There's also different types of glaucoma, and there's the open angle glaucoma, but then there's also the narrow angle glaucoma. And so with people that have narrow angle glaucoma that the eye doctor would tell you you have, or it might be that it runs in your family, people that are farsighted are more likely to have narrow angle glaucoma. Those individuals, if they take antihistamines or if they take a scopolamine or, use the seasickness patches, it can dilate their pupils and can make their eye pressure go up. So if they have narrow angle glaucoma, they'd want to discuss it with their eye doctor. Do they need to be careful taking those medications? For people with open angle glaucoma, they could take the antihistamines and using the seasickness patches. They shouldn't have any problems with that.
An interesting question from one of our participants, which I think fits well with your discussion today. Is there any evidence that healthy lifestyle actually can result in lower use of eye drops or medications? So let's say somebody does more actively try to have a healthy lifestyle and does more exercising, does a lot of the things that you suggest, maybe gives up smoking or whatever. Are there any studies or is there any data to show that you might actually be able to reduce the amount of medication you need and still maintain healthy eye pressures?
No. Because the issue is that for the exercise, it lowers the pressure maybe a point or two. And so if you have a patient that you're treating for glaucoma and they're on medications, for them to do a healthy lifestyle, a lot of them in my practice already come in and they're relatively healthy. But for them to radically change their life and go to a healthy lifestyle, there could be a study looking at if you then took away their medications and then checked them a month later, where was the pressure? And you could follow it that way. But it's kind of a individual tolerance for the pressure. And so as far as I know, there haven't been any studies where someone's on medications and you take them away once they've gone from a sedentary lifestyle to a healthy lifestyle, for example.
Okay, well, I think we aren't at the end of our time, but I think unless you have some other thoughts you would like to add.
Well, there's one question that I brought up about water loading, and so the definition of that is drinking like a liter of water over 5 minutes. So you want to make sure you spread it out. And so you want to kind of not drink a lot of water in 5 minutes. You would kind of drink it over an hour. So that's what water loading is.
Okay, well, I would like to thank all of our participants. I particularly want to thank Anne for all of her thoughtful, her presentation and very thoughtful answers. And I want to remind all of you that you can learn more by visiting our website, glaucoma.org. And there is a tremendous amount of information, including a very extensive booklet on understanding and living with glaucoma that you can download for free, or you can request a copy, and we're happy to provide it at no charge. And this teleconference will be on our website in a few days, and also we will provide to all participants where we have your email information. You will be getting an email with a link to the webinar in case you'd like to listen to any of it again or share it with a friend. I also would just like to make a special, plea, if you will, as the holidays are coming up. We think it's important to talk about glaucoma within your family. One of the saddest things that happens is when we find someone, especially a young adult, who discovers that he or she has glaucoma and may already have even lost some vision, and only to find out that a parent or a relative or a grandparent had glaucoma and that it's in the family. So if glaucoma is in your family, it does mean you're at elevated risk. So I would just encourage you at the coming holidays when family are together, not to be embarrassed to let your family know that you have glaucoma or that it's in the family and that they should get their eyes tested. And that's especially true for the higher risk groups, people of color, African Americans or Latinos or Asians who have a higher incidence of glaucoma. So again, thank you all for joining us. Thank you, Ann, for the wonderful discussion. And with that, I will adjourn the teleconference. Hope everyone has a great day.
Thank you.